Hi, everybody, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, the Educational Programs Coordinator for MS Focus, and I'm joined by Dr. Herb Karpatkin, who will be spending the next half hour with us answering your questions about physical therapy and MS. So, Herb Karpatkin is a doctor of physical therapy who is a board certified in neurology and geriatrics. In addition, he's also certified as a multiple sclerosis specialist. Dr. Karpatkin, we're so pleased to have you, and we're looking forward to the Q&A. I'm sure everybody has questions. So let me give everyone a little refresher first. For those that have not been with us before, please keep all of your questions in the Q&A area with that app. Let's not put anything into the chat area. We're going to leave that for anything coming in from Facebook. So just put everything you want, whether it's a question or a comment, into the Q&A area, and that will keep everything flowing much quicker and better. You can also, if you want, you can ask your question live by raising your hand. And if you're on the phone, you can hit *9. And of course, you'd have to unmute yourself when I when I call on you. So that's it. Let's start from scratch. Hold on a second. Let's see. So Deborah, I like that name, Deborah. That's my name. So could you provide examples of exercise for help with managing foot drop?
Sure. So, first I want to make sure, can everyone hear me okay? Good.
I can.
Okay, so foot drop usually refers to a combination of things. Um, it refers to weakness in muscles called the tibialis anterior, which is the muscle that picks up the front of the foot so that you can land on your heel when you walk. It also refers to tightness in the muscles of your calf, which makes it harder for you to pick up the front of your foot. And usually foot drop is a combination of those two things. So if you want to address it, you really have to do three things. First and most importantly, you have to stretch out your calf muscles. And I'll say at the beginning of my talk right now, I can't, uh, you know, demonstrate or give you over a webinar the exercises to do. But if you contact me by email, I will send you the specific exercises. And this is something we've always done. MSF has been really great about helping out with this. So you have to do an exercise to stretch out your calf muscle. The next thing you do is you have to do an exercise to strengthen the muscles in the front of your shin, which pick your toe up. And then the third one is after you've done those two, you have to practice walking where you really focus on landing heel first. So it's a combination of three things. Foot drop is actually not one thing, it's a combination of things working together. And because it's MS, it's progressive. So you need to start working on it as soon as possible, and you have to keep working on it.
Thank you. Also, could you provide examples of exercise for high intensity gait training? Would that be different?
Sure. I'm glad you asked that. I've been doing a lot of research into high intensity gait training for persons with MS, and really impressed with how effective it is.
Hmm.
All you really need to do is instead of walking when you practice walking, instead of walking slowly for long distance, you do short walks at a faster than normal pace. So say if your normal pace is 2 miles an hour, you have to practice walking at 3 miles an hour. But you only do it for about 20, 30 seconds. And then you stop, recover, and do it again. So the idea is you do short bursts where you push yourself to walk faster than is really comfortable other than for just a few seconds. Then you have to recover and do it again and again and again. In my research, we're having patients do it for about 20 minutes with 30 seconds on, 1 minute off. Uh, and they're doing it twice a week. And the improvements that we're seeing are very, very exciting, very significant. And we're
Nice.
comparing it to a condition where the subjects are only doing 20 minutes of continuous walking, slow pace, gentle, continuous walking, 20 minutes. Those subjects improve also, but not nearly as much.
Hmm, good information. Can PT help reduce muscle stiffness, spasms, or weakness?
It can reduce it, it can't cure it, right? Meaning that it can, if you have muscle spasms or spasticity, the only treatment I know that's effective in treating that is medication, either baclofen or tizanidine. What PT can do is reduce the frequency and intensity of them, but like everything else, you have to do it a lot.
Hmm,
Stiffness is a related thing. Persons with MS can have stiffness because of spasticity, or they could have stiffness because they're too sedentary. And stretching can absolutely improve the stiffness that occurs because people with MS are too sedentary. All of my patients stretch a lot.
good. So now I know summer is hot. It's brutal everywhere, everywhere. I don't know of anybody telling me they have good weather. But can you tell us some strategies to conserve energy during the day, especially during the summer?
Well, the most important thing is, in my opinion, keep yourself cool. Um, Cooling vests, we've done a pretty extensive amount of research looking at the effect of cooling vests on different aspects of mobility in MS. We've looked at its effect on walking, we've looked at its effect on balance, and what we found uh, is even with patients with relatively severe MS walk better and balance better if they do some basic cooling before they walk. So in one study, we had patients come in and they would wear a cooling vest for a half an hour, and then we'd have them walk as far as they could for 6 minutes. Then we had them come back a week later and do the exact same thing without a cooling vest. And they walked much farther in the cooled condition than in the uncooled condition. In another study, we had them ride a stationary bike for 20 minutes, either wearing a cooling vest or without a cooling vest. And then we tested their balance. Their balance was much better if they were cool. So the only thing that I am 100% positive will improve your life when it's hot out is to do everything you can to keep yourself cool. Now, here's where I put in my standard plug for the MSF because they do supply cooling vests, and I urge people to take advantage of that. There's no reason not to. Um, and the cooling vests that the MSF um, supplies, these are the ones I used in my study. I didn't use anything fancy. So I urge everybody to take advantage of that. It works so well, it's so easy, and it's inexpensive.
Dr. Karpatkin, I learned a couple years ago that there's different kinds. I don't work in that department that supplies them, but I did learn because I bought one for myself. I don't have MS, but I can't tolerate heat. So I learned that the one I bought was not the correct one for living in South Florida. So there's different kinds, and when they contact the foundation for one, they'll probably ask you, where do you live? And, in terms of the amount of moisture in the air, I guess you need a different kind if you're living in a dry area versus the other, if it's going to work better. So I didn't know that, but it was a pretty cool information. So, um,
Well, strictly speaking, you're correct, but I would rather, you know, whether it's dry heat or humid or wet heat, cooling is always going to improve.
mhm.
So You can always fine tune it a little bit, but cooling will always be effective.
Yeah, people contact us afterwards and rave about how it's helped them. They're able
Yeah,
to function, go out in their garden, they're able to go outside, and it's a fabulous thing, the vest. And the neckties and the hats and all of that stuff is
yeah,
fabulous.
yeah. And it's simple stuff. I think that's one of the reasons it appeals to me so much. There's nothing fancy about it. It's basically covering your body with a few ice packs. But
Yes.
the reason it works is uh, when in either hot weather or during exercise, if your core temperature increases, it conduction through demyelinated nerves decrease.
Hmm.
So by increasing But by cooling yourself off, you're improving the conduction through demyelinated nerves. It's really relatively simple, but and I've been a PT specializing in MS for close to 40 years now, and it's always been a happy surprise for me how well this works, and always a little bit of frustration that more people aren't taking advantage of
Hmm. Yeah, there's even products. I have something called Cool Girl Pearls. They look like
it.
Wilma Flintstone pearls. They're huge, and you keep them in the freezer in a package. And when you leave, you take it in this insulated little package, and you can put it on, and it gives you an instant zap of energy within seconds. And there's all different brands of that also. So it's pretty cool. If you really need that stuff, there's a lot out there. So anyway, another
Wilma
question.
Flint, Wilma, Wilma Flintstone, you're dating yourself.
Wilma Flynn, yes, I know. Half the people won't know who she is. But are there
Yeah.
any common exercises I can do if I have bladder or bowel issues from MS, and something to help that?
Yes, there are. Unfortunately, I'm really not the person to help you with that. But I can absolutely help you get in touch with people who can. There's a whole new branch of physical therapy called pelvic floor physical therapy, and a lot of persons with MS have issues with bowel and bladder because of the MS, but there are exercises that can improve that. I don't have the training in it, but I do know from the papers that it's very effective. And again, if you get in touch with me, I will direct you to people who can help you with that. But the research so far and the reports that I'm hearing are extremely positive.
Wonderful. Do you have any thoughts of using virtual reality to help with indoor exercises?
Um, so I'm a relatively low tech guy. So uh, I know everybody is excited about VR because it is, the newest and the grooviest thing around. Um, my feeling about it is if it makes you exercise more than do it, um, there is a lot of research that's being done. Um, I don't find it very compelling. It's just another way of doing the same thing. That being said, the research shows that VR works just as well. Um, non-VR. Uh, um, so again, when people ask me about it, I say, if this works for you, then by all means go do it. But
It's true. Everybody's different, right?
yeah,
Everybody
can
has a
people still
different
hear me? I
reaction.
just got a message from my. Can you still hear me? Okay.
Yep, it's a little different, the sound of your voice, but we still hear
Okay.
you.
Okay. Let's keep going.
Okay. So somebody just asked if there's an income level minimum for the cooling vest to be given to them. And I will tell you that anybody that has MS with a diagnosis of MS can apply for a cooling vest or a cooling product. And I believe there is some income information on that application, but it doesn't mean you have to earn a certain amount or too little or whatever. So fill it out. I will be honest with everyone though, our cooling program, the applications stop being accepted on June 1st. So we're already there. What we do because we want to get the product to the people before it gets hot. So what we do is we tell everyone that the MSAA, the Multiple Sclerosis Association of America, has a year-round cooling program. So when ours ends, we generally tell everyone, if you'd like and you don't want to wait till next year and you can't afford to buy it yourself, by all means apply there. So that's what I'm going to tell the person who just asked about that. So, okay. How about how do I find a physical therapist if I live in a small town?
You contact me and give me your contact information, and I help you find one. That's how. This is something I do on all these talks. Um, I have been working with the American Physical Therapy Association to create a provider map for persons with MS as well as other conditions such as Parkinson's disease. And the map has uh, located people throughout the United States. We're still missing a few states. The Dakotas, for some reason, have not joined up, but everybody else has. And if you get in touch with me and give me your contact information, I will very happily find persons with MS experience, therapists with MS experience, who are close to you.
Wonderful. And if anybody wants to respond to the reminder email that was sent to you for this teleconference, if you respond to us and tell us that you'd like Dr. Karpatkin's information, his contact information, we'll go ahead and send that to you. All you have to do is just send it right back from where we sent it to you. Are there any signs of overheating that I should look out for during physical activity that I might, before it gets really bad? Or they're like subtle signs that I might see? And then I have to say, okay, calm down.
That's a really good question. Thank you for that. Um, if you notice, for example, that it's your steps are getting a little bit shorter, or your vision is getting a little bit blurry, or your hands are tingling, or your feet are tingling, that could definitely be a sign. It's much better to stop before the symptoms get bad. A lot of persons with MS will often push themselves, try to push through the difficult period. And that's actually one of the worst things you can do. Um, the harder you push, the worse the symptoms will get. So I encourage people to not uh, try to push through heat, but respect it. And uh, when you feel at the first onset of symptoms, take a break. You will get much more work done if you take a break and recover and then get back to it than if you try to push through it.
Thank you. So I understand, we all age and people's symptoms, some of them mimic MS symptoms because of age. So how do I differentiate between age and MS, aging and MS, if I start having symptoms that are hindering my physical activity, my physical ability to do things?
That's a really super interesting question, one I've been dealing with for quite some time. The when I first started working with MS, there was really no such thing as an old person with MS because persons would progress to a point that, and they would often expire or be institutionalized before they would reach a certain age. Now there's a whole new diagnosis of aging with MS. And as a result of that, I made sure that I got board certified in geriatrics. Here's what I'm finding. The most important thing, whether you have MS or whether you're an older adult, or if you're an older adult with MS, keep moving. Keep moving as much as you can. Avoid being sedentary as much as you can. That is probably the main reason that older adults with MS end up struggling. That they have, it's not the disease, it's not the aging, but it's the impact of the aging and the disease leading you to not move. Now, the next question everybody asks is, how much is enough moving? And here's my answer to that. And I call this the yuck factor. And I call it the yuck factor because what I'm asking you to do is do enough exercise, enough movement so that it's a little yucky, so that it's a little bit unpleasant. You have to go into the unpleasant part. Okay? If it's comfortable, if you don't push yourself, you're not going to get, your body is not going to adapt to the stress of the exercise. So you have to maintain moving and you have to do it to the point where it's a little bit unpleasant. Okay.
Hmm. I agree. I mean, I think in general with aging, you have to keep moving.
Yes.
I've used that quote from you hundreds of
Yes.
times to everyone I know. So,
Glad to hear that.
and I hope it's sinking in because I keep saying it over and over again. So when should I go for PT? I never know when's a good time. And should I
Right
start
now,
doing it on my own, or should I go first before trying to manage it on my own? Or what do I do?
you need to see a PT as soon as possible, so they can figure out what exactly, what exact type of physical therapy you need. Okay, you need to, because physical therapy is not generic, and especially for MS, when everybody is going to present somewhat differently. So what a PT will do, a good PT will do, is create a physical therapy program that is specific to you and your specific MS. You know, I'll see 10 patients in a day. Each one is going to get a different treatment from me, depending on how their MS presents.
Hmm. What do you think about the difference between, obviously, some people are able to go to a PT doctor and others have to have them come to them, right? Is it still super beneficial to have them come to you
Um, a
if you have to have
short
them come
answer,
to your house?
short answer, yes. Uh, some PT is always better than no PT. Um, uh, I think the question is really more if how will you get the best PT? If you have to travel a little bit to see someone who's really skillful, that might be better than somebody coming to your home who doesn't have as much training. But in the final analysis, it doesn't matter as long as you get the PT.
Mhm. Is there a secret to getting insurance to pay for it? I know that's like a magic.
Oh,
I know.
don't get me started. Um,
I know so
um,
many people
y-
can't.
I, it's a big part of the world of PT and MS right now. Your doctor has to be able to write a message, write a letter to the insurance company. Your physical therapist has to do it, um, and it has to detail the fact that without the therapy, you're going to regress, and which you will. Physical therapy is well proven to decrease the uh, progression of the disease, or reduce the progression of disability from the disease.
Mhm.
Persons who exercise do better than those who don't. And the insurance company, you know, you have to just assume from the get-go that their main job is to make sure you don't get therapy, that their job is to make sure, when they pay you therapy, when they cover therapy, it's money out of their pocket, so they're going to try their best to make sure that you don't get it. Um, but what I found is the more you annoy them, at some point, they don't want you to annoy them anymore, so they'll cave in and cover you for 10 seconds, for 10 sessions, for 12 sessions.
Mhm.
But the other thing, and this is super important, you don't need PT to exercise. You need a PT to show you what types of exercise you need. But I never like it when I hear people say, well, I had 10 sessions with PT, but then insurance stopped paying, so now I don't do anything. That's ridiculous. The PT should show you exactly what you need to do. The PT should show you exactly what you need to do in order to continue your progress. Uh, the PT should give you a home program that is specifically needed to, excuse me a second, the PT should be able to show you a home program that is specific to your needs and that you do it as a home program. Sorry, I just had to change rooms.
That's okay. You know, I think in general, you have to find a doctor who either their staff or themselves will advocate for you, right? Isn't that going to
That's
help
correct.
if you get a good staff that's going to fill the right forms out and argue with
A-
the insurance and all that stuff for you? So,
Absolutely correct. And it's part of the role of the healthcare team to be an advocate for the patient. I feel like that's a big part of my role right now.
mhm. Are there any exercises that can help with multitasking, like moving while thinking?
Absolutely. And if you contact me, that's a great question. There's a whole field of study called dual task therapy. And if you contact me, I will send you some examples of those exercises.
Nice.
That's a really important thing.
Yeah, it's not easy. So good. We don't have any more questions. We have a few more minutes. If anybody has a question, this is your time to put it in. So all those burning questions you've kept inside, this is your opportunity to.
If you don't have any questions now, but you think of them, email them to me, and I always get back to people. Sometimes it takes me a few
You are so nice
days.
and so kind to
Okay.
do that. You always offer that, and not everyone does. So we are extremely grateful for that. So no, I don't
Well,
think we have any more questions unless you have something that you want to say. Um, let me just,
um, I will finish up. Move,
okay.
go for the yuck,
Um,
keep cool.
okay, cool. Are there any, let's see. Okay, so let me just, since nobody's asking anything, I'm gonna go and close out. Thank you, everybody, for attending.
Okay.
It does bring us to the end of
Okay.
our time.
I need to run. Thank you, everybody.
Yes, goodbye, everyone. Thank you so much. Thank you, thank you. For everyone that is staying with me for a moment, I'd like to tell you that if you've missed any part of this conference, it has been recorded and will be available through the MS Focus Facebook and the YouTube channel. Please reply to your registration email for information on how to access the recordings or to sign up for our newsletter to learn about upcoming events. Also, you'll be receiving a short survey when you leave the conference. We'd greatly appreciate your feedback, which helps us determine what type of information is most meaningful and helpful to you. As our attendees of the conferences, we'd really like you to have um, the type of webinars to attend that really help you. So our next teleconference is Tuesday, June 24th at 6 o'clock p.m. Eastern. In honor of National Pride Month, MS Focus will be hosting a live MS patient panel discussion that's titled Voices from the Multiple Sclerosis LGBTQ plus community. Our sincere thanks to all of our attendees for your participation, and of course to Dr. Karpatkin that had to leave a bit early. We're so thrilled that he continues to do this every other month for us, where he'll answer all your questions. So get your questions ready. for next time, and he'll be there to answer them. Thank you, everybody, and have a wonderful evening.